everybody, it's Dr. Khadisha, and it's been a week since my second dose of the Moderna COVID-19 vaccine, and I am so happy, and I'm so grateful that I was able to get that vaccine so that I can be able to treat people and see COVID-19 patients safely, more safely. And I just want to help to provide some reassurance to those who are concerned about getting the vaccine, and talk about an upcoming discussion that we need to have. So again, I'm Dr. Khadisha. I'm your board certified emergency medicine physician. I've been practicing emergency medicine for 10 years. I'm a best-selling author of the book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. If I only had the time, and it's an answer to, I would say about 12 years of questions, complaints, and concerns that ER patients have sent me, given to me, written about me, friends and family have expressed. And it's all in this one very easy to read book full of pictures and I say like a little mini workbook inside. But anyway, I wanted to let you guys know that I've gotten my second dose of COVID-19 vaccine. It was the Moderna vaccine. It's given about 28 days between the first and second doses. The Pfizer vaccine, I believe, is 21 days in between the first and second dose. And I don't think I had any effects. I don't think I had any ill effects. Now, I did hear about people having muscle aches, fatigue, chills, things like that after the second dose of vaccine, but I didn't. And I can tell you that maybe there were some things that I did that maybe you can do when you, if you so choose to get the vaccine. And a couple of things I did were, one, I made sure I took Motrin, and I took Motrin and Tylenol before, before getting the vaccine, and on schedule right after, after getting the vaccine. So I didn't like double dose or anything like that, but, I just took them as scheduled. You take your Tylenol every 4 to 6 hours, and you take your NSAIDs, one dose every, depending on which one it is, every 8 to 12 hours, based on the dose. I took those around the time that I got vaccinated. Other things that you can do to prevent some of the side effects of getting the COVID-19 vaccine, and just about most vaccines, is to take those medications, one or the other, or both if you dare so, like myself, and you could apply a cool, clean compress to the area of injection, the site of injection, and just make sure that you use that arm, exercise that arm so that it doesn't get too stiff. Also know that after getting vaccinated, that doesn't mean immediate immunity. It takes the body a couple of weeks to mount a proper immune response to vaccination. So, and even after those 2 weeks, it is still greatly advised that you continue to mask up, wash your hands, sanitize, and socially distance even after getting vaccinated. There's still a small chance that one could contract COVID-19 after getting the vaccine. However, it is expected that symptoms will be either non-existent or very, very mild. So you still have to think about your chances of becoming ill and or possibly passing it on to someone else. There's still a small chance of that. So just wanted to let you know that. So, maybe expect some pain, swelling, and redness at the injection site, but you can possibly prevent that with cool compresses at the injection site and by taking the over-the-counter Tylenol and or Motrin in anticipation of some chills, fatigue, headache, things like that. But I got my second dose of the Moderna vaccine and I'm feeling just fine. I actually got my second dose of Moderna vaccine a week ago and on Monday, and I actually did a shift on Thursday or Friday, and I had no issues with it. So yes, you're going to hear some stories of people having more side effects, especially after the second dose of vaccine, but a lot of people aren't going to have any side effects. So, and I was one of those people. Now, of course, people are still worried about, severe allergic reactions and things like that. And the CDC does give a list of people who probably shouldn't get vaccinated. And it's a few criteria. So if you've had a severe allergic reaction, meaning anaphylaxis or an immediate allergic reaction, even if it wasn't severe, to any ingredient in a messenger RNA COVID-19 vaccine, you should not get a messenger RNA COVID-19 vaccine. If you've had a severe allergic reaction or an immediate allergic reaction after getting the first dose of the vaccine, and immediate allergic reaction means one including hives, swelling, wheezing, any kind of respiratory distress within 4 hours after getting vaccinated. So that's an immediate severe allergic reaction. If you've had one of those severe allergic reactions, even if it wasn't, or if it was immediate, even though it wasn't severe after getting the first dose, then you shouldn't get another dose of messenger RNA COVID-19 vaccine. And thanks so much, guys, for coming on in. Definitely say something in the comments to let me know you're here. Thanks so much for joining me. I'm on my cell phone, so I can't really see who all is in the building, but thank you so much for coming on. Yeah, maybe I can see you in the comments here. Let me see here. Okay, so those are the criteria for folks who probably shouldn't get vaccinated. And if you, by any chance, happen to know that you are allergic to polyethylene glycol and polysorbate, while polysorbate is not an ingredient in either of the messenger RNA COVID-19 vaccines, it's not an ingredient in neither the Moderna nor the Pfizer vaccine. Polysorbate is closely related to polyethylene glycol, which is in the vaccine. So polyethylene glycol is in the vaccines. So people who are allergic to polyethylene glycol or polysorbate should not get a messenger RNA COVID-19 vaccine. And you can learn more about COVID-19 vaccines and allergic reactions on the CDC website. So yeah, I'm not saying that every single person should be vaccinated with the COVID-19 vaccine. The CDC actually does list these things as reasons not to be vaccinated. So if you've had an immediate allergic reaction, even if it wasn't severe, to a vaccine or injectable therapy for another disease, ask your doctor if you should get the COVID-19 vaccine, and your doctor should help you decide if it is safe for you to get vaccinated. But for those folks who are still waiting to get vaccinated, I hope that you are taking into consideration things that you can do, things that you can get vaccinated for. While you're waiting for that COVID-19 vaccine, ask yourself, are you due for the Pneumovax vaccine? Are you due for the pneumonia vaccine? I know it's given every couple of years, every few years. Ask yourself or ask your doctor if you are due for that vaccine. Did you get the flu vaccine? Did you get the shingles vaccine? Things like that. Vaccines aren't just for kids. There are also vaccinations that adults have to keep up with throughout life. And, those vaccines, no one's talking about those vaccines. Nobody's talking about the Pneumovax, flu, or shingles vaccine. Still get those because those infections are still out there. I'm seeing a number of patients who come in for COVID-type symptoms, but COVID-type symptoms are symptoms that you see with multiple viral infections. And many of the patients that I've seen, we check them for flu, strep, and COVID-19. Flu, strep, and COVID-19, and all of them end up negative. And the patients ask, well, if it's not COVID, what is it? There's still whole families of viruses, the same families that have been getting us sick for centuries. They are still out here getting us sick. So why not make sure that you are vaccinated against the bacterial and viral infections against which you could be protected? So get that flu, shingles, Pneumovax if you're due for those things. But also know that once you get those vaccines, you'll have to wait 2 weeks before you can get the COVID-19 vaccine. Or say some of you have already gotten the COVID-19 vaccine and you're like, oh my gosh, why didn't I get the Pneumovax vaccine? Why didn't I get the flu or the shingles vaccine? I should have gotten that. Yeah. You're going to have to wait 2 weeks. So if you got the COVID-19 vaccine, you're going to have to wait 2 weeks before you get any other vaccinations. And if you get any other vaccinations, you're going to have to wait 2 weeks before you get the COVID-19 vaccine. So enough of that. I'm sure you watch discussions about COVID-19 all day long. And so I want to talk about another issue of discussion that hasn't gone away. That's the issue of sex, the issue of sexual safety. Valentine's Day is coming up. A lot of people are going to be partaking in sex with known partners, unknown partners, one partner, multiple partners. And it's interesting, but National Condom Week starts on Valentine's Day and goes through the 21st. Well, I want to get the discussion going about sexual safety before Valentine's Day, because preparation for sex, preparation for sexual safety is not just a physical thing. It is a mental thing as well. It is a mental thing as well. How one deals with sex starts with how one thinks about sex, how someone sees sex. And you have to have your safety in mind. At the very least, you should have your mindset ready as you approach Valentine's Day or, any sexual encounters that you may feel pressured to have just because it's Valentine's Day weekend. I guess that's why the national observance for Condom Week is this weekend. So what is sexual health? What is sexual health? Okay, and I'm going to give you the World Health Organization definition of sexual health. Okay, so let me see, just get my computer going here. Okay, it's frozen, but basically the World Health definition of sexual health is actually a state of physical, emotional, mental, and social well-being in relation to sexuality. It's not merely the absence of disease, dysfunction, or infirmity. It's actually a state of physical, emotional, mental, and social well-being in relation to sexuality. And that means part of that is having your safety in mind regardless of what your partner may want you to think, or want you to believe, or may want you to think is okay or isn't a big deal or anything like that. You've got to keep your safety in mind. So that means, wearing condoms. That means, being able to have a conversation with your partner about their sexual history or any symptoms that they may have or not have. If they don't have any, ask when was their last checkup, things like that. Because and people ask, well, why do you want to talk about this? I want to talk about this because sex is still going on. Because I'm still seeing people in the emergency room, men and women of multiple ages, who come in because of multiple scenarios that got them in their various situations. I've spoken with a wife who was reconciling with her estranged husband, who started having, discomfort and a discharge 3 weeks into their reconciliation, and had to call her and tell her that she had chlamydia. I've had to, examine a 15-year-old girl who had a large vaginal ulcer, and had to discuss the possible causes of such an ulcer with her and her mother. I've had to do the first prenatal exam on a pregnant young lady and tell her that she had chlamydia, and she knew that her boyfriend's side chick was the one who gave her chlamydia, because her boyfriend had symptoms and he was honest enough to tell her that the side chick had symptoms. But here she is at the beginning of a pregnancy, also infected with chlamydia. So it's still going on, so the discussion still has to go on. And if you don't feel like it's for you, at least share it with someone for whom you think this discussion is for, because if it's not for you, then it's definitely going to be for someone that you may know, or someone that someone you know knows. So we're going to talk about sexual safety February 10th, 8 p.m. Central Time, here on my Facebook page. And I definitely want you guys to join in the discussion. It's going to be, a health-based discussion. There are, definitely, stories from the ER that I'll be sharing, but we've got to have this discussion, especially before Valentine's Day. We have to get ourselves mentally prepared for Valentine's Day, so that we do exactly what we want to do, and we don't do anything that we don't want to do. So join me 8 p.m. Central Standard Time, February 10th, here, so that we can discuss sexual safety as we head on into Valentine's Day weekend. Okay, so be safe, be successful. Know that I'm a week out from getting the second dose of Moderna vaccine. I feel just fine. I had no side effects. I worked a shift a few days after getting the vaccine. However, I did take naproxen and Tylenol in anticipation of any chills, headaches, or fatigue or muscle aches that were possible, or that would have possibly happened after getting that second dose. I heard about the effects. I'm not trying to sugarcoat those side effects, especially after the second dose of Moderna. I took medication in anticipation of those side effects. I had my cool compress ready for the injection site, but I'm not sure that I needed it. I did just fine, and a lot of people are doing just fine after their second dose of COVID-19 vaccine. And if you're waiting for the COVID-19 vaccine, and you don't know where to go, call your local or state health department to see how you can get on a wait list. If you have no primary care doctor, and if you do have a primary care doctor, of course, call their office to see how or when you can get the vaccine. And after all that, ask your primary care doctor, what vaccines can I get while waiting for the COVID-19? Am I due for the Pneumovax? Am I due for flu? Am I due for the shingles vaccine or any other vaccines? And just know that if you get any of those vaccines, you're going to have to wait 2 weeks before getting the COVID-19 vaccine. And if you get the COVID-19 vaccine, you're going to have to wait 2 weeks before getting any of those other vaccines, but they are definitely important. Flu, Pneumovax, COVID-19, those should all be discussed together. And I will see you February 10th at 8 p.m. Central Time so that we can go into Valentine's Day weekend in a state of sexual mental health. This is Dr. Khadisha, your board-certified emergency medicine physician, best-selling author of the book, Help Us Help You in the Emergency Room. I help people with my book, my Facebook Lives, and consultations. I help people feel better, be safer, and better prepared for emergent medical situations. You can definitely check out that book and the Mobile MD Kit, as well as the Mini Mobile MD Kit made expressly for cold and flu season, any viral infection season, at www.drkadishamd.com. Rest well, and I'll see you February 10th. Bye.